Everyone, welcome. Thanks for joining me today. This will be a pretty informal presentation. I hope that if you have any questions about any of your medications today, that you have a venue to ask them here. I have a little presentation about common medications that people who suffer a stroke are typically on. But I do want to emphasize that everyone's very unique. Every situation is very unique, and every stroke is unique. And so you might not be on a lot of these medications, or you might be on every single one that we talk about today. So it just really depends. And if you have questions about that, I can help answer those. And if we need to, we can kind of defer to your physicians or your doctors and make sure we come away with some understanding. To start the presentation, I wanted to briefly mention that there's a few things that we ask patients to do specifically after stroke with their medications. And the biggest thing that can help the physicians and pharmacists that you might interact with is to make sure that you have a list of your medications. And if you don't have a list of your medications, that you at least know where all your medications are filled at and which pharmacy you use. We really hope that you use one pharmacy that really allows that pharmacist and that provider to be able to get an accurate list of all your medications. It also allows the pharmacist to make sure that there's no interactions with your medications. And so some of the medications that we do use for stroke can interact with each other. And so it's important that in those situations that the pharmacist is able to look up your medications and make sure that they're all safe and effective for you. So let's get started. We'll start with their first drug class of medications. And they're referred to as antiplatelet medications. And these might look really familiar to you. And some of these are used outside of stroke. And so the most common antiplatelet medication is aspirin. Most people who suffer from a stroke take an aspirin, and it's usually a lifelong medication that you'll be on post-stroke. There are different formulations of aspirin. Some of you might know a medication called baby aspirin. We don't like to refer to it as baby aspirin because it's not for children or for infants. It's just a smaller dose of aspirin. So there's a baby aspirin, which is 81 milligrams. That's our low dose aspirin. And then there's aspirin that's 325 milligrams, and that's a higher dose aspirin. And depending on your situation, you could be on either one of those doses. There is what we call enteric-coated aspirin, and that medication has a special coating on it, and it helps prevent any side effects from aspirin in the stomach. And so some people might experience stomach discomfort from their aspirin, and we can switch it to an enteric-coated aspirin, and they might tolerate that a little bit better. But typically, patients don't experience that, and either form of those aspirins, enteric-coated or not, would be fine. Another very common antiplatelet medication is called clopidogrel or Plavix, commonly referred to as its brand name. While these are both antiplatelet agents, many patients will actually be on both for a period of time post their stroke. And so many of you might have seen Plavix. Sometimes we have patients just on Plavix. Sometimes we have patients on Plavix and aspirin. And sometimes we have patients take one or the other for 21 days, 90 days, a few years. And so it's always important when we talk with our neurologist or our physician that's managing our stroke that we ask them, hey, which antiplatelet should I be on? Should I be on it forever? Should I be on both of these forever? It's a good question to ask because things can change. And so 3 months from after your stroke to a year after your stroke, we can have a conversation about, do we need to continue both of these medications, or do we need to stop one or switch to a different one? And then a less common antiplatelet medication that you may see is called Agrinox, and that's a combination of aspirin and dipyridamole. It's not as common as our aspirin or Plavix that we use, but I wanted to include it here for completion's sake. And so real quickly, how they work: antiplatelet medications, they inhibit the formation of blood clots, and that's by preventing the platelets in your blood from sticking together and causing clumps and therefore clotting a vessel. In a stroke, that vessel is in the brain. And so why we use these medications is to prevent those blood clots. It reduces our risk of a further stroke. And then it also has the secondary benefit of protecting us from clots otherwhere in the body, such as in the heart, which would be called a heart attack. And so outside of stroke, even these medications can be useful. So we'll pause there. If anyone has a question, you can type it in, or if you can unmute yourself and ask. Any questions about antiplatelets that we can go through? Okay, I'm not seeing any questions so far, so we'll continue on. Real briefly, I wanted to go over possible side effects. Antiplatelets are pretty well tolerated by most people. We have to think we're kind of thinning the blood, or we're preventing clots. So the opposite of that is we have too much bleeding. And so possible side effects we can see is maybe you get a really bad bruise on your arm or leg and you're not sure where that came from. Like I said, with the aspirin, some people can have a stomach upset or maybe a symptom like heartburn, and that could kind of key us into maybe the aspirin or the Plavix is irritating the stomach. And then more serious signs of bleeding, such as bleeding and you're vomiting and you see blood in the vomit, or you see blood in the urine or stool. This can be a sign of that we have a more serious problem. And so if we see signs of severe bleeding or even minor bleeding, we want to let our physician or doctor know about those. For Agronox, it has some side effects that are unique to it. It can cause headache, flushing, and can cause a yellowing of the skin or eyes. And so if we see one of those side effects from Agronox, we would want to let our physician or even pharmacist know about those. Okay, so we'll move on to our next medication class. These are anticoagulation medications, or commonly referred to as blood thinners. Not every person with a stroke will be on a blood thinner. When you're in the hospital, you might remember some of these. You might have been given these as a shot in the stomach or in the arm while you're at the hospital. But then afterwards, many people don't leave the hospital with a blood thinner. Now, depending on some specific factors and what your doctor decides, you may go home on a blood thinner. And so some of these might be familiar. The most common blood thinner that historically was used was warfarin or Coumadin. And then there's some newer medications, and you'll see they all end with ABAN. So we have apixaban, rivaroxaban, edoxaban, and dabigatran. And you can see their brand names there. And so some of those might be familiar. Common medications used in the hospital include that Lovenox or enoxaparin or heparin. And those last two are injections or shots that the nurses will typically give to you while you're in the hospital. The other medications are oral medications that you would take after you leave. So why do we use potentially anticoagulation medications or blood thinners in stroke? Again, just like the antiplatelets, they work in a different way, but the end outcome is very similar. We prevent a blood clot from forming in our arteries or in our veins that potentially could lead to a stroke or a heart attack or a DVT, as some would call. So they work somewhat differently. Warfarin has a unique mechanism of action where it competes with vitamin K, and this prevents the clot from forming. Those other medications that I talked about that end with ABAN are called DOACs, or direct oral anticoagulants, and they reduce blood clotting factors in the blood and therefore prevent blood clots. And then enoxaparin and heparin have a similar reaction, but like I said, those are injections that you would receive. And so why do we use these medications in stroke? These medications, again, reduce the potential for any blood clots from forming and reduces our risk of a stroke or a heart attack down the line. Common side effects, as you can imagine, are very similar to the antiplatelets. So we're having blood thinners, we want to watch out for too much bleeding. And so any unusual signs of bruises or bleedings, any of those serious signs such as blood in the vomit, urine, or stool are really important to watch out for. And if we experience any of those, to let our pharmacist or our doctor know. And then specifically with warfarin, we have to make sure we maintain a steady diet. It interacts with a medication, interacts with a substance that's in food called vitamin K. We just have to make sure we stay consistent with our diet if we're on that medication called warfarin or Coumadin. And with these medications, we really want to avoid heavy alcohol consumption. Specifically with the anticoagulants and the antiplatelets, if we consume too much alcohol, that can cause stomach issues and can lead to stomach bleeding. And it can also lead us to potentially having falls. If we consume too much alcohol, we may be unsteady on our feet and things like that. And if we fall and maybe hit our head or something, that could turn into a life-threatening issue if we have a bleed there. And then, like I said, always important to key in with your pharmacist or doctor about any potential drug interactions when starting a new medication. So if you're on a blood thinner or an antiplatelet and maybe a neighbor, someone recommends some herbal supplement such as like a vitamin or an herb, to make sure that we just check in with the pharmacist, make sure that it doesn't interact with any of our blood thinners or any of our antiplatelets. We don't want to cancel out the effect of those and potentially put us at a risk for stroke. For those patients that are taking warfarin, this slide is for you. I just want to briefly touch a little bit more about vitamin K and diet. There's a misconception that patients might have when they start warfarin or Coumadin that they have to avoid certain foods. And that's not the case. We just need to stay more consistent with foods, especially those foods that are high in vitamin K. And you'll see, based on that list there, such as turnips, soybeans, Brussels sprouts, lettuce, cauliflower, cabbage, broccoli, spinach, those are all really healthy, good foods. We don't want patients to avoid those and not eat these healthy foods. We just need them to stay consistent. So we don't want to go on any spinach salad bins or all of a sudden 1 week, all we're eating is Brussels sprouts for dinner every day. We just want to make sure we stay consistent. So if we like to have a spinach salad every other day, that's totally fine. Just staying consistent is the most important thing. Okay, let's pause there again. Any questions about any of the antiplatelets or the blood thinners that we talked about? Go ahead and feel free to chat. If you want to chat or unmute yourself and ask a question, that's fine. And if there's no questions, that's totally fine as well. We'll have time at the end of this too if you want to say anything. All right. Okay, not seeing any questions, so let's go ahead and continue. Our next medication class are called statins, or maybe cholesterol medications. They're actually HGMA-CoA reductase inhibitors. And these lower the amount of cholesterol in our blood. Many patients after a stroke are going to be on these. These are very important medications that we take after a stroke. And you might say, Zach, I don't have high cholesterol. I eat very healthy. And one of the things we'll learn today is that these medications, outside of lowering cholesterol, have some different effects to the body, especially after a stroke, that seem to be very beneficial in preventing a recurrent stroke from happening. So it's important, even if our cholesterol is okay, that we continue to take these medications, that we talk to our doctor about that before stopping anything. So these medications, you might notice some of these names include atorvastatin or Lipitor, fluvastatin, lovastatin, pravastatin, simvastatin, or rosuvastatin, also known as Crestor. So some of these might be familiar to you. How do these work? Like I said, they reduce the amount of cholesterol in the body. And we know that cholesterol can contribute to forming those clots in our blood that eventually might go to our brain and cause a stroke. Outside of lowering cholesterol, they have some anti-inflammatory effects as well. And this is a very beneficial thing post-stroke, is that we reduce inflammation, especially in the brain, and that this medications prevents strokes from happening down the line. So it's important that we stay on these. Side effects with statin medications include muscle weakness. And this is the biggest one that we watch out for. And it can be to a varying degree of muscle weakness. So some people might experience this for the first few doses and it goes away, and that's wonderful. And some people might experience really painful muscle weakness or muscle aches after starting this medication. It's important that we let our doctor know that this happened. We can easily treat this. We can switch to a different statin. A lot of patients who may receive muscle weakness with, say, simvastatin can switch to an atorvastatin or Lipitor and be totally fine. And so if we can do that for a patient, we really want to do that. We don't want you to experience side effects when we have other alternatives. Big things to watch out for with statins is we don't want to eat any grapefruit or drink grapefruit juice when taking these medications. So if you're someone who really enjoys grapefruit or grapefruit juice, we have to find an alternative while we're taking one of these medications. And again, we want to limit alcohol intake. Statins get processed by the liver. And if we put too much stress on the liver with alcohol, we can have an increase of side effects such as that muscle weakness. All right, any questions about statins or any of those medications we just talked about? Feel free to chat. I'll be keeping an eye on that. Or if you want to unmute yourself, you can feel free to do that as well. All right, I'm not seeing anything, so let's go ahead and continue. Our next, the next thing I want to talk about is blood pressure medications. Blood pressure or hypertension commonly goes with stroke. A lot of patients who experience a stroke, it might have been caused by hypertension. But either way, after a stroke, we have to be very careful with patients' blood pressures and making sure that they're at goal. If we have too high blood pressure, we can cause what we call a hemorrhagic stroke, or where bleeding occurs in the brain. And it puts us at a higher risk for an ischemic stroke, or we get a blood clot in the brain. And so I want to go over common blood pressure medications that you might see and that you maybe can ask your doctor about. So some of these might look familiar, and this is by no means a complete list of all blood pressure medications, but these are just the most familiar that we see. So the drug class we see a lot is called ACE inhibitors, and these include lisinopril or enalapril or quinapril. Those might sound familiar. Or a second drug class that's very similar to ACE inhibitors called ARBs, or angiotensin 2 receptor blockers. And these might be referred to as losartan or candesartan or olmesartan. These medications work. They lower a substance called angiotensin in your body. And this allows your blood pressure to be lower, and it reduces the amount of stress on your heart, so your heart doesn't have to work as hard. These medications, like I said, reduce future strokes and as well as different heart diseases such as heart attacks and heart failure. And people who take these medications who have had a previous stroke, if they stay on these medications and they're at goal, it reduces their chances of dying in the future. And so we want to be it's really important to stay on this medication as well as our patients who have maybe diabetes as well as a previous stroke. It can help control our diabetes a little bit better and reduce further complications from diabetes. Possible side effects from these two drug classes include dizziness, a dry cough, or swelling of the face and tongue. And these are important. This can happen anytime. So we could be on this medication for, say, 3 or 4 years, and then all of a sudden we start noticing that maybe our lips or tongue starts swelling. And this could be a medical emergency that we really need to let our doctor or pharmacist know that that's happening. The dry cough is particularly important with the ACE inhibitors such as lisinopril. We start noticing that we have a dry cough. It could be a multitude of things. It could be maybe a little infection or pneumonia creeping up, but it potentially could be one of our medications. And if we could stop that medication and switch it to something else, we could get rid of that dry cough. Different things to watch out for. You might get your blood tested to see what your potassium levels are. And so if anyone's wondering about that, we can always ask the doctor how our potassium levels are while we're taking these medications. And then it's important if you're planning on becoming pregnant, or if you are pregnant, that we have to stop these medications during that time frame. And then also with our blood pressure medicines and pretty much any of the medicines we talked about, a lot of patients get hung up saying, oh, I have to take this with breakfast, or I have to take this with dinner. We really want you to take your medications when it's convenient for you. And say, if you like to take it with breakfast, that's perfectly fine. We can take it with our meals. We can always check with our pharmacist on our specific medications if there's any restrictions. But like I said, we just want to make sure you take your medications when convenient. So if you like taking it with breakfast, you like taking it with lunch, if you like taking it at bedtime, talk to your pharmacist about that. Make sure it's safe, but typically we can take these medications at any time of the day. Our next blood pressure medication class include beta blockers. So common beta blockers you'll see include atenolol, carvedilol, or metoprolol. So some of those might be familiar to you. Beta blockers work by causing your heart to work less hard and therefore reducing the blood pressure in your body. This also can help the heart get back to a normal function. So if your heart was a little stressed and working too hard, your beta blocker can kind of slow it down, give it a little bit of rest, and allow it to improve its function. Similar side effects include dizziness, shortness of breath, or fatigue. And so if we've noticed that after we start a beta blocker, we don't have as much energy, we maybe have a little more dizziness or shortness of breath, we can key into that being the cause, possibly. Talking to our pharmacist or doctor about that. All right. Well, that's the common medications we'll see. Now, like I said, there's many other medications that patients after stroke might be on. And so if you're concerned about a medication that you're on right now and you want to ask a question, or if you want to ask a question about one of the medications that we talked about, feel free to get in the chat and do that. I'll stick around for some time here. But like I said, if you have questions and you don't want to ask them now today, wherever you fill your medications at, there's a very competent and willing pharmacist there who can chat with you about your medications. And we can always wait until we see the doctor again and bring up